Dear audience, dear chair, welcome to the progress report. In the upcoming minutes, I would like to talk about my PhD, which is assisted reproductive technology. Let's have a quick introduction to the first topic that I have. Total fertilization failure is a very unfortunate event occurring in every 5 to 10% of assisted reproduction cycles. Unfortunately, genetic testing for this is done quite late after many failed attempts, which leads to many unsuccessful and unnecessary interventions on women who are undergoing this journey. In our study, we could identify certain oocyte gene mutations, which causes total fertilization rates increase up to 68%. Physicians should indicate genetic testing for women who have been diagnosed with unexplained infertility. The further research should focus on gene editing methods to elevate the success rate of assisted reproduction. Policymakers should consider making genetic testing obligatory for women who have failed attempts. My name is Begüm Kepkep. I'm a first-year PhD student, and I'm here with a vision of decreased psychological burden on couples during assisted reproduction. And to meet my vision, I have a mission of finding a safe and effective technique to increase the success rate of assisted reproduction. We have two ongoing projects. We started both them in 2024. We have a common background for our projects. Infertility is becoming a global issue and affecting approximately 15% of couples worldwide. We have a so-called technology such as assisted reproductive technology being used as a first-line therapy. However, certain couples can conceive even with the help of assisted reproduction due to a phenomenon called total fertilization failure. And as we already discussed, this phenomenon occurs in every 5 to 10% of assisted reproduction cycles. We talk about TFF, but what actually is TFF? Total fertilization failure means that all the oocytes which have been inseminated in one cycle has failed to get fertilized. Our first topic is investigating the effect of oocyte gene mutations on fertility outcomes during ART. Several gene mutations of oocytes, such as WEE2, PATL2, and TUBB8, interfere with oocyte maturation phases. And as we all know, adequate oocyte maturation is the prerequisite for fertilization. Therefore, the inadequate maturation results in fertilization failure. A genetic panel can be produced with the results of our research, and our aim is to conduct this research, which investigates the relationship between oocyte gene mutations and total fertilization failure. Our clinical question is, does having certain oocyte gene mutations increase the risk of total fertilization failure and result in lower fertility rates? We are using PECO framework for our project, in which the population is women undergoing assisted reproduction, and the exposure is women who have oocyte gene mutations. We compare this women to the ones who have no mutations. Our primary outcome is total fertilization failure, and the secondary outcome is fertility rates. We hypothesize that having certain oocyte gene mutations increase the risk of total fertilization failure and result in lower fertility rates. Our clinical and research implication is creating a genetic panel according to the results that we have. We used a search key which was composed of two domains. The first domain was referring to the population, and the second was referring to the outcome. We ended up 170 articles with the first search, and then we added 78 more with the citation chasing. So it was a big project to handle. Let's move on to the results. This table is a summary table which shows the total fertilization failure rates in patients with oocyte gene mutations. On the left-hand side, you can see the list of oocyte gene mutations which we assessed in our project. They are grouped in according to their effect sizes, low, medium, and high. The outcome, as you can see, is TFF, and the unit we used for this table was proportion. In this table, you see 0 and 1. 0 meaning no total fertilization failure occurring, and 1 meaning occurring of total fertilization failure. As you can see, not all of the oocyte gene mutations have the same effect. For example, BTG4, FBXO43, MAY1, and the other ones which are grouped on the low effect have no effect on the oocyte gene, the total fertilization failure. However, medium and high ones have effects on total fertilization failure. This is a table specifically given for the WE2 mutation. So as you can see, the proportion is 0.68, which is fairly a high number. And in here, you see the table for comparison, which represents the patients who didn't have any oocyte gene mutations. And in this table, you can see that the proportion is 0.09, which is very low compared to the mutated patients. We're currently in the manuscript writing phase. Actually, I finished writing my manuscript, and my supervisor has also gone through it. We're waiting for the SMS approval, and then we will send it to the internal review. Our project definitely has strengths and limitations. The biggest strength we have is the high number of included studies, which is over 100, and the homogeneity of data reporting in the exposure group articles. But of course, we have limitations in our study as well, which is the indirect comparison in between exposure and control group. And this is mostly caused by the single-arm studies that we found for the exposure group. In conclusion, we can say that several oocyte gene mutations increase the rate of total fertilization failure and cause a decrease in fertility rates. We have implications for practice and research. The implication for practice we have is indicating genetic testing for women who have unexplained infertility. And for the research implication, we need more studies that should be conducted globally that assess the relationship between oocyte gene mutations and total fertilization failure. And gene editing methods should be researched more deeply to elevate the success rate of assisted reproduction. Let's move on to the second topic. Investigating the effect of sperm gene mutations on fertility outcomes during assisted reproductive technology. As we all know, fertilization is composed of two domains, the oocyte and the sperm. In the first project, we mainly assess the oocyte, and in the second project, we will be assessing the sperm side. Total fertilization failure can be caused by several sperm gene mutations, such as PLCZ1, ACTL7A, and ISUMO1. And our aim in this project is to conduct a research which investigates the relationship between sperm gene mutations and total fertilization failure. The clinical question is quite the same. The only difference is that the exposure in this case is the sperm gene mutations instead of the oocyte gene mutations. In summary, we have two ongoing projects, the first one focusing on oocytes and the second one focusing on sperms. And we would like to submit our first one in October this year, and the next one the second one in March 2026. I would like to end my presentation with a quote from Albert Einstein. It's not that I'm so smart, it's just that I stay with problems longer. Thank you for your kind attention.
Thank you very much, Begüm.
Thank you for a great presentation. I was just wondering, I might have missed it, do you have data on how common these mutations are in the general population?
Yes, they're not that prevalent. They're around 0 and 1%, so they're not that common.
Okay, thank you.
Just a short hint, calcium oscillation, I think it's a vital part of the story, so you're on the right track. Okay, congratulations. Thank you very much.